Okay, we're in Kijabe Hospital with Steve Letchford, who's the medical director. Steve, you just want to explain a little bit about some of the infrastructure that you've been able to get hold of through Cisco?
Sure. Well, a few years ago, Cisco helped us access a few wireless data points, one of which is up here. And we have worked over the last few years trying to figure out how to use those best for educational purposes or data collection. Some of the other technology that we need to make good use of it has not been available, and so we've tried different things. This past year, Cisco has helped us access a few tablets that could be used, and what we'll look at today is the way that really is a pilot project for us out here, is helping us transform data collection both for our TB patients as well as for our HIV antiretroviral treatment patients. So.
Okay, yeah. So do you want to hand over to Edwin to talk through that?
So let me introduce you then to Edwin, who is the technical brains behind making all this happen.
Thank you.
Okay, Edwin.
I'm the Strategic Information Officer for the HIV Clinic. Well, before we got these tablets, we initially used to collect data from physical files, putting them into computers, and after that we eventually report them to the clinician. But now, thanks to these tools, we've been able to integrate our systems to the clinic, where we have clinicians and doctors collecting data from triage, entering directly to our servers, and we can be able to do reporting to them automatically. If you don't mind, I can show you some of them practically in use.
Sure.
On our first implementation phase, we started it off with a TB program. It's an access program that collects data on TB care and treatment. We did it with Solomon here. If you don't mind, you can also have a look at the system.
Okay.
Well, how the system runs. The system collects data from here. The database is within our servers. As soon as it enters data on these, it integrates them from there, and anybody within the network can be able to access this information, not just him. And the reports are automatically generated also from the server and presented on the same application.
How are you finding it to use? Are you comfortable, or is it too big or too small?
I'm comfortable with the gadget because they can move around with it. It's a bit portable compared to the former computer that I'm using. So you can say to me, it has been of much help to me. So I can move around with it. Yes, that's a good thing with it.
Very good. And what are the plans for the future?
For the TB?
Do you hope for TB using this technology?
We are improving our application from an access database to an ASP application, which we hope will be a web-based application at this point. It means you can be able to access this information from anywhere. And we have satellite clinics that are far from this region. Some of them are close to 70 kilometers from here. So we are hoping at that point we can have these tablets being used on the satellite clinics. They'll be working with them right from there. Another application I'd like to show you that is now our big time. It is IQCare. It is our main application. It's a web-based application that we are looking forward to now blowing it out into a web-based application. If we are able to, it will work real time on the satellite clinics as well. In clinic, we have here Catherine, our HIV services manager. We have Robert Mulo, our clinic, triage nurse, and we have Margaret, one of our patients. I'd like to show you how we've been able to implement using the motion computers on one of our biggest applications so far, which is IQCare. It's a web-based application that we can be able to see patients directly through. And the good thing with it is that we intend to have it on a more public domain, where we can be able to access it through all our clinics, wherever we are. Actually, that was the initial phase of initiating the whole IQCare program. So here we have Mulwa using the application directly has received a patient in the triage clinic.
So I can see there's the tablet there, and then I can also see there are the notes for the patient on the table.
Yeah.
So what are you doing on the tablet right now?
Yeah, what I'm doing is I'm getting the patient's information, which is the information that is in the file is also in the IQCare system. So mostly I want to get like the recent CD4 count, which was done I would get the time it was done and the next that it's due, which is 1st of August.
Okay.
So that enables me to get the information of the patient. Sometimes we have the files missing, but you can be able to get the whole information here and go ahead to see the patient. That's one of the things that these machines are helping us do. The other thing is, in case you need an information, you don't have to keep calling to get the information from the data office. You are able to access it yourself.
You have it in your hand.
Yeah, you have it in your hand. You can move within a clinic and be able to get the same information. Yeah, so it's like
I would say I have a dream. And the dream for us is to have applications going down to the doctors, to wherever they are. We have doctors taking medication and care to the patients. So we also want to bring our technology to the doctors. As they go to see patients, we have some doctors seeing patients at home, and there are some who also see patients not just in the clinic, but some patients even come home on call. So what we'd like is if we could be able to have our systems not just on the computers, not just on the tablets, but also on smartphones, where they can be able to access our systems 24 hours, anytime, see patient history all the way dating back to when the patients are coming, directly through their phones. Part of this was the development of acute care, our web-based application, was to now narrow it down into a mobile application, which can be used on smartphones. The good thing is that right now in Kenya, smartphones have become a bit cheap. The only problem has been security, network security, and access to the internet, or maybe wide area networks that can be developed to access acute care and systems that we have widely to wherever they are. But our projections have always been, we go a step at a time. So right now with the tablets, we've been able to bring at least our technology to where they're seeing patients within the hospital. A patient can be seen directly without having to go for a file. A patient can be seen and data is entered automatically. So right now what we want is the system to coordinate within all departments of the hospital. A patient will come directly through the hospital. At records, they are recorded that it's just coming to the hospital, and when the patient comes to the clinic, the computer already recognizes the patient. So the doctor will just know this patient came in at this time, it's already been queued. They'll see the patient. Maybe if the patient is sent to the lab, just make a request of a lab request directly from the clinic, and it's already noted in the lab. So when the patient goes to the lab, it's already noted. They check the lab without having to converse with anything. And the patient is then sent to the pharmacy, and the prescription has already been sent there directly through our system. And what we'll have is a very good coordination within the hospital. And by the time the patient leaves, there actually has been no paperwork done. A paperless clinic, that's what we call it here. It has been initiated in the Vasha clinic, one of our main clinics. And here, we've also gotten a boost with the wireless network. That way, the system also becomes mobile. Because initially, we had it on desktop applications, which meant you could not move, you could not do anything. But now we can be able to see them. We have doctors actually taking pictures directly through the tablets. And with the tablets, they can be able to discuss on discussion forums, social sites with other doctors and explain issues that they are facing. And we hope to do that also now on mobile applications.
Mm-hmm. Yes. Okay. So at the moment you've got 4 wireless sites operational and 5 tablets.
Yes.
So you've got some demonstrable successes in some particular areas, but you're looking to expand both within the coverage within the hospital and also out into the community using other devices as well, including smartphones.
Including smartphones, yes.
Fantastic.
Because we have doctors who see patients and they are quite mobile. One of the things they'll always carry around is a phone. So if they had the phone with them and the system with them within the phone, it would make work much easier, it would make data collection very much easy. And one of the advantages we've gotten from this data collection is research is taking place very fast here. We already have a research department that has conducted a number of research activities within the hospital and in AIDS relief using our data. So I would say this is not just a development in patient care, it is also a development in improving care through research.
Fantastic.